Good morning. Good morning. Thank you. Thank you for joining us. We'll start a little bit later than we had intended, but no worries. We're just collecting ourselves. But I hope everybody had a wonderful evening and is ready for some very interesting education today. Thank you for joining us, and I do hope you enjoy. Good morning, Dr. Amanda. Welcome.
Morning. Thank you.
All right. I think we can get started. Good morning, everyone. Thank you for joining us today, this wonderful event. Today, Lupus Ascending Foundation, in partnership with the Lupus Foundation of Kenya, bringing you a topic on the maternal well-being of mothers with lupus. The conversation is aimed at bringing awareness on the well-being and support systems needed for women with lupus during pregnancy, childbirth, postpartum care, and even miscarriage. So this message should go out to everyone, supporters, warriors as well, and their primary caregivers and guardians. It is not locked off to any gender. All are welcome, men and women. So we have an auspicious and wonderful panelist today, our wonderful Dr. Amanda Kenya. She's an obstetrician and gynecologist dedicated to advancing women's health through clinical care, research, and advocacy. She specializes in sexual and reproductive health, holistic and equitable maternal health care, and menopause care. She brings a compassionate, evidence-based approach to supporting women through all stages of life. Dr. Kenya has a special interest in caring for women with chronic conditions such as lupus, providing them with tailored, multidisciplinary care during pregnancy, childbirth, and the postpartum period. She is also a vocal advocate for mental health integration, pregnancy loss support, and patient empowerment in medical decision-making. Thank you, Dr. Amanda, for joining us and for your time as well. And we're looking forward to learning a lot more from you. So I open the floor, so to speak, for you to, tell us probably why you joined this line of medicine or why you specialized in this. Welcome.
Thank you. Thank you so much for having me today and for inviting me. I'm very honored to be here. Why I chose this specialty is because it's never a dull day. Taking care of women is always exciting. There are ups and downs. There is surgery involved. There is obstetrics involved. That means pregnant women. There's a bit of pediatrics because, we deliver small babies, so we have to know how to take care of them as well. There's psychiatry because there's a lot of mental health that needs to be taken care of when we're dealing with women. There's internal medicine, things like pneumonia. So there's so much. There's cosmetics as well. So you'll never find a day when you're bored or when you're tired of doing the same thing every day. So I'm someone who likes to keep, doing all sorts of things. So it's perfect for me.
That's brilliant. We are always so happy when somebody passionate is doing what they love and improving everybody's life as well. We give a special clap for that one. So yeah. We have Doreen who's raised a hand. Yes, Doreen.
Oh, she's clapping.
She's clapping. Okay. Thank you, Doreen, for clapping. We appreciate it. Yes. So what I want to let everybody know is that we will listen to Dr. Amanda take us through her presentation. And then thereafter, if there are any questions from those who are present, you may feel free to just type it in the chat and then we will get to those. If there are any questions that I will also come up with after the presentation, then I will engage with Dr. Amanda first, and then we'll go to the effectively Q&A. So Dr. Amanda, if you're ready, I will be changing this to sharing presentation.
Sure.
You're ready to go.
Okay, good. So like we said earlier, today we're talking about maternal well-being of mothers with lupus. So these insights are not just for lupus warriors, but for caregivers as well and guardians. I made sure to use simple language that everyone can understand, but of course, if there's anything you don't understand or you want some clarity on, feel free to raise your hand. And of course, this is hosted by Lupus Ascending Foundation and Lupus Foundation Kenya. So just a brief introduction. I don't think anyone here needs to be told what lupus is, but just in case, Systemic lupus erythematosus is the full name, and it's a chronic autoimmune disease that disproportionately affects women in their reproductive years. So autoimmune means that your immune system, the system in your body that is supposed to protect you from all sorts of things like infections, becomes overactive and starts attacking your own cells, different cells in your body, okay? Like your heart, your kidneys, and your lungs. So that's what autoimmune means. And SLE or lupus has a tendency to affect women in the reproductive age. The reproductive age is the age where women are able to have children, okay? So pregnancy in lupus, fortunately, now is safer than it's ever been before due to advances in healthcare, but there are still a few risks. So today our objectives are to educate the warriors and caregivers on pregnancy-related concerns and promote preconception planning. I'm a big proponent of preconception care and safe antenatal care. And then, of course, encourage the involvement of male partners and guardians in this support system because they can definitely not be left out. So, like I said, more women than men have lupus, and more women in the reproductive age are affected. So 9 out of 10 people with lupus are women, and usually between the age of 15 to 45. And this disease can impact your fertility, which means it can make it difficult to get pregnant. It can impact your menstrual cycles, so your bleeding patterns, and it can definitely, as I'm sure everyone here knows, impact your mental health. So how does it affect your menstruation? It's because of the changes in the hormones that happen during bleeding, during your cycle, during pregnancy, and even after delivery, when we have a rush of hormones. This can all affect your lupus symptoms and the frequency of your flares. So there are some things that we need to know as we go into a pregnancy with lupus. This is not, of course, to fearmonger or make you afraid, but I do believe information and knowledge is power. So when we go in knowing, we're definitely more likely to succeed. So the risks that we need to look out for are lupus flares. So this can be especially the kidney flares or the hematological flares. That's the ones that have to do with your blood. Another risk when you have lupus and you're pregnant is preterm labor. So going into labor before it's time to deliver the baby. And also intrauterine growth restriction. This means that baby is not growing as fast and as big as we would like when you're pregnant. So you end up having a tiny baby. Preeclampsia. Preeclampsia is a condition whereby during pregnancy you have high blood pressure. So if you have lupus, you have an increased risk of developing this condition, especially if you have lupus that is affecting your kidneys or you have an antiphospholipid syndrome. So it's important to have your lupus stable for at least 6 months before conceiving. This has been shown in studies to increase the risk of you and to increase the possibility of having a good outcome in that pregnancy. It reduces the risk of flares and complications during the pregnancy. Of course, some women do get pregnant without planning. So you get pregnant even when your disease is active, but that's, it's not the end of the world. There are still things that we can do to try and protect the pregnancy and keep you as healthy as possible. But ideally, 6 months of disease quiescence is good. Then it's important to have close monitoring, not just for you, but for your baby as well during the pregnancy. So this is not going to be a situation where you skip your antenatal visits. It's going to be a situation where your obstetrician and your other specialists, like your rheumatologist, maybe if you have a kidney specialist or a lung specialist, we're all going to be in your care team and having regular meetings to make sure that we're all on the same page and everything is going well. Preconception counseling is important, not just for women with lupus, but ideally for every single woman who wants to get pregnant. So for women with lupus, we need to start this planning in a way in advance, even up to a year in advance. First of all, we need to confirm that the disease is inactive using blood tests and also using your own symptom tracking journal. And then we need to look at the medications you're on And if there are teratogens, which are medications that can cause abnormalities in the babies, like mycophenolate or methotrexate, we need to wean you off them and start you on different medications, switch you to the pregnancy-safe drugs like hydroxychloroquine, azathioprine, and prednisone. Then obviously before you get pregnant, there are some autoantibodies that we need to check if you have, like anti-Ro and anti-La and antiphospholipid, because these can cause a syndrome in the baby, if you have them, called lupus neonatal syndrome, which can be temporary, but sometimes it persists in the baby. And then also, while you have lupus, even if you're not ready to get pregnant yet, it's important to have a gynae with whom you discuss your fertility, your contraception methods, and your lifestyle and mental readiness for when the time comes. Then it's important, if you're planning to get pregnant, to begin folic acid and consider supplementation with calcium and vitamin D. These are all supplements that we give to women who are planning to get pregnant, even if they don't have lupus, but more so if you have lupus, we want to make sure that the levels of these minerals and vitamins are sufficient in order to have a healthy baby who is developing well, especially in the first trimester. So when you actually get pregnant, we need to know that this is a high-risk pregnancy. That means you might not be seeing a regular obstetrician. You might need to see someone who is what we call a maternal fetal specialist, an MFM. And these doctors, there are not so many in the country, but we do have quite a few. And it needs a multidisciplinary team, like I said earlier. So you will need to visit the doctor, the obstetrician, about every 2 to 4 weeks. And then when you get close to the end, it will need to be weekly. So you can see how heavy these visits are going to be quite often. And then during the visits, there are things that are going to be monitored keenly, like your blood pressure and your urine. In your urine, we're looking for things that can indicate that you have preeclampsia. Okay, that's a condition where you have high blood pressure that starts affecting your kidneys. We're going to be doing very many fetal growth scans to see if baby is growing well or if they're developing that intrauterine growth restriction that I was talking about. And we also are going to keep doing your serologies, so checking your blood for these autoantibodies to make sure that there's no risk of neonatal lupus, that's lupus in a newborn. Then, of course, there are some preventive measures that we're able to do now that we did not have before. Due to studies, we have realized that taking aspirin from when you're about 12 weeks pregnant can help to prevent developing preeclampsia later on in the pregnancy. So preeclampsia is the high blood pressure. And then obviously it's important to address mental health concerns proactively. So during your visit, you're going to be prompted about how you're doing psychologically, just so that we catch anything early in advance and we're able to give you all the support you need, and even medications if needed. Right, so like I said, when you have lupus and you get pregnant, it is possible to get more flares than usual. Some women actually get less flares, but some get more. And for some women, it doesn't change. But just in case it happens, it's important for you to be able to distinguish a flare from the normal pregnancy symptoms, because sometimes they can be similar. So it can be challenging. For example, we have joint pain, fatigue, we have rashes, versus the normal pregnancy discomforts. There are some warning signs and some red flags, danger signs that we need to be aware of, so that if we experience them or if we see them, the doctor needs to be made aware. So for example, if we're doing blood tests and we see that your kidneys are not functioning well, so your blood is showing a high creatinine, proteins in your urine, your platelets are dropping, those are blood cells that help your blood to clot. If you have fever, if you're developing the rash, the lupus rash, and also if you have unexplained severe fatigue that is not quite adding up to pregnancy, then your doctor needs to know and your entire team needs to know. So again, we had already mentioned the treatments which are safe, the hydroxychloroquine and the prednisone and the azathioprine. But we're supposed to avoid non-steroidal anti-inflammatory drugs. We call those NSAIDs. For example, diclofenac, maramoja, after 20 weeks of pregnancy. These can cause a problem with the baby's heart. So any drug you take, basically, you need to ask your doctor if it's safe for you to take, not just when you have lupus, but generally when you're pregnant. Right, so this is an area in maternal health that is often ignored, postpartum care and breastfeeding, but especially postpartum care. After delivery, there's a rush of hormones that happens that can really affect a woman, both mentally and physically. But you find after she has delivered her baby, all the attention now goes to baby and whether she's producing milk, if that's enough for the baby. And we kind of ignore the mom who is actually going through a lot, right? Now imagine that plus lupus. There's a lot that needs to be addressed. So it's important, more so in a woman with lupus. It's a period that is very high risk for getting flares, again, because of that rush of hormones. So it's important to plan follow-up with a rheumatologist within 4 to 6 weeks. A lot of women end up missing these visits because they're, overwhelmed with taking care of baby. Maybe they don't have enough support at home. So it's really important for your whole team to be able to track you and make sure we don't lose you to follow up. And even your support system at home needs to be aware. Again, with breastfeeding, the same drugs which are safe in pregnancy are the same ones which are safe in breastfeeding. And usually there's no change that happens. Mental health considerations are really important, like I said earlier. Even women without lupus are at high risk for getting depression. But now when you add lupus on top of that, the risk is even higher. So we need to be able to monitor you, and your partner needs to be on high alert, or your support system at home, so that they can know the symptoms and be able to know what is abnormal and what is not normal. For example, what is baby blues versus what is postpartum depression. And then, of course, it's important to rest and have all the support you need and the self-care. And this requires planning, right? So if you need an extra nanny, if you need a relative to come and stay home with you, don't be shy to ask for all the help you need. Right. So more about caregivers and support networks. Like I said, you might not be able to track your symptoms and your medications alone. So it's important for your caregivers to be able to help you with that. They can also assist with taking care of your baby and daily tasks like cooking and cleaning the house, and even providing emotional support. Your family, especially your male partner, if you have one, having them actually reduces the risk of being stressed and developing depression. So they are important, and you need to be able to communicate with them. And they also need to be in contact with the doctors, your care doctor team, or a nurse if you have one, to help you make decisions. Of course, it's important to have support groups and organizations like Lupus Ascending, to have this engagement, to have a community, people who are going through it with you, to just make life a bit easier and knowing that you're not alone. Next slide, please. Yeah, so basic takeaways is that it's possible to get pregnant and to have a safe pregnancy with a good outcome when you have lupus. Preconception planning is extremely important, and having a specialist care. And also, women, we need to empower ourselves with the knowledge and support. Thank you, and I'm happy to answer any questions.
Thank you so much. Thank you so much, Dr. Amanda. That was very illuminating. What I did want to ask is, with regards to just how delicate, as well as the number of people, the multidisciplinary approach to pregnancy with lupus. What I was wondering is there, how does, in a situation where you're dealing with like midwives, in a situation of maybe somebody whose income situation is not as good as somebody who is middle class or upper middle class and the like, is there any kind of like template or advice in that situation, how a midwifery would help or not?
I'm not sure I understand your question. You mean how would someone with low resources be able to have all this care?
Yeah, in that sense, like they may not be able to come to the doctor all the time.
Yeah.
And my wonder is whether somebody who's like because I'm not sure how far the knowledge
Mm-hmm.
that we were discussing today, whether it permeates to every party who can be involved in a pregnancy in that situation, because I think at this point we can say that lupus affects any across all social classes and the like. So in a
Absolutely.
situation where somebody is maybe in a place where they're not able to access this kind of care, but they might be dealing with like a midwife who operates in a particular area,
Mm.
whether in that situation, whether it would, how would we handle that, or is that where we would come in as a community organization to try and also get that information out, like what you've presented, to those who would be offering such a service, like a midwifery and the like.
Yeah, I think that's where we would come in, because truly there's no replacement for specialist care. And it's not fair for women who have lupus to have less care than they need, less than the standard. So I think we can come in as a community to pull together. I'm happy to help specialists who are willing to maybe discount their services, and we just have like a standing team that is available to provide care, even if it's online care. And then your midwife, wherever you are, can be a part of the team as well. Do you see what I mean? So, for example, you and your midwife will be having the visit every 2 to 4 weeks, and then your rheumatologist, kidney specialist if you need one, heart specialist if you need one, are able to have visits with you online, whereby they are making sure the midwife is checking certain parameters they need. If they need you to go to a laboratory where you are, they can ask you to do so based on the symptoms you're telling them about, or the parameters they're seeing that are abnormal. Because someone doesn't always have to be there physically, but it's important to have a specialist checking in every 2 months or so. And I think that's something we can make happen for women all over the country. Yeah.
Great. Yeah, well, that sounds really good. And I think it would go to a long extent to help people who are with the condition and want to have children, that it would be the best way to try and get as much care as we can to them.
Yeah.
Yeah. As well as that, I just wanted to ask about, you mentioned a particular condition that can affect somebody who has lupus in pregnancy. And I'm not so sure what it means, like antiphospholipid syndrome. Was that correct? Would you expound on that?
Antiphospholipid syndrome is whereby you have certain antibodies in your body that can make your blood clot more than the normal person. So this means that you can have blood clots at any given time, but more so when you are pregnant. So this is something that can affect someone who doesn't have lupus or someone who has lupus. And when your blood is clotting a lot, if your body is not able to dissolve those clots fast enough, you end up having a blood clot in your leg, which leads to, I don't know if anyone here has known someone who has deep vein thrombosis, that's DVT, when you have someone with a swollen leg because they have a clot in their leg. Or you can have a clot in your lungs, which is called pulmonary embolism, which is very dangerous. So those are some of the antibodies that we check for.
Okay. Well, that's very interesting. Okay, thanks for explaining that one. So wanted to ask whether anyone has questions for Dr. Amanda. Feel free to put it in the chat, looking at it over here. And yes, unless somebody wants to vocalize the question that they have, do let me know. Raise your hand. Hi, Caroline. Yeah, feel free to ask your question. Let me see.
Sorry.
Mm.
Hello, Dr. Amanda. Thank you so much, also Lupus Ascending, for organizing this session. I have gotten a bit. I was on the road, so I was not able to get the entire session. But from what I've heard, especially the first part, is that there's hope. That is really encouraging, that despite living with the condition, getting to work with other care providers can give hope to the person to be able to give birth safely and even carry on their pregnancy safely. So thank you so much, Dr. Amanda, for enlightening us.
You're welcome. And thanks for mentioning that. That's something I'm super big on. There's always hope. You know, as women, we're always putting other people first and taking care of everyone else. And sometimes we don't even sit down and think to ourselves, is there hope for me? You know, I think I need help in this. Then we end up ignoring and putting ourselves last, but there is hope. Trust me, there's hope. Okay, so there's Valerie, who happens to be my friend. Hi, Val.
Morning, everyone. Happy Saturday. Thank you so much for this session. Thank you, Dr. Amanda. I think it's been very, very enlightening. Your presentation was awesome. Just 2 questions for me. I think the first one is with regard to I'll call them new medications that are coming into the market or are already in the market that we are seeing lupus patients taking, other than the traditional prednisolone or HCQS that have already been for a couple of years. I think specifically, maybe I can mention one of them, like rituximab, which we know already is in the market, and there are a couple of people who are already on it. You didn't mention about it, but it would be good to hear what a patient on rituximab would need to do if they need to get pregnant. That's question number 1. Then question number 2 from me would be, you mentioned that you need to have your lupus in remission for at least 6 months before you can try to have a baby. What happens in the event that a lupus patient has low C3 count or active, well, not active lupus, but in this case, I'll talk about C3 count, which I think is important to consider whether or not you have a flare, and your C3 count has been low for quite some time. What then happens in that situation with regard to being pregnant or getting ready for pregnancy? In the case where it's been consistently low and you don't know when you'll probably have it go back to normal levels. Thanks.
Thanks for that. So regarding your first question, rituximab, and in fact, I was just thinking this morning, Eric, that it would have been nice to have a rheumatologist in this panel, because some of these are truly rheumatologist-specific aspects that I may not be able to answer, but I do know that rituximab is reserved, at least for now, for severe or refractory lupus, especially lupus nephritis or the hematologic complications. It's not the first line of treatment. It does cross the placenta and get to the baby. So you might find some doctors are really hesitant and maybe might want to even stop it 6 months before pregnancy, and some doctors are a bit less strict and are happy to continue with it. I would have to reserve that for a rheumatologist, that answer, but maybe I can talk to my colleague and get back to you, Val. And the same goes to the other question, about the C3 levels. That would be crossing my area of specialty, which is why we need a multidisciplinary team.
Wanted to say thank you to Carol, who's a friend of the foundation and a repeat guest as well as panelist. And then also thank you, Valerie, for your very insightful question. I do have one more question for Dr. Amanda. I wanted to ask whether my understanding is that most like the doctors who are working with their patients who have lupus keep talking about the importance of exercise. And in this particular situation where you have like all these things that have to be looked out for, dealing with like the multiple organs and the situations they could be in as the pregnancy advances, is that how, when the pregnancy is now, like it has started, we're talking about like the first trimester and going ahead, whether whether exercise still factors into the whole situation, or if there's an adjustment required in that respect.
I think this applies to women even who don't have lupus. So the general advice is whatever exercise regimen you are doing before, you can continue as long as you feel physically able. So, you find a lot of pregnant women, once we have whatever exercise we're doing before, and then, or maybe we're not doing any exercise, then once we get pregnant, we want to be healthy, we want to do it for the baby, and then we start doing new exercise routines that can be quite strenuous, especially in the first trimester. So it's important to just, whatever you're doing, you can keep doing it, but try not to add extra things that might be stressful to your body, because your body might be like, okay, so now we're clearly going into war. I'm a soldier, and this might not be the best time to be pregnant, and we might end up having a catastrophe. So walking is great. Walking is always great. Stretching exercises are also great, but don't feel the pressure to join a gym and start a whole new exercise regimen.
All right. And that also goes in concert with the kind of diet that would be supporting both the pregnancy as well as the exercise that the pregnant woman is,
Yeah, exactly. Diet, good nutrition, and supplementation of those key vitamins that I talked about. The folic acid, vitamin D. Even now, it's important for everyone here to know their vitamin D levels. It's most likely low, and calcium as well.
Great. Thank you. Thanks so much for your wonderful answers. I think we're all better informed now. And as we continue to learn, since everything is always about the journey of understanding and knowledge. So if anyone else is willing to ask a question, I still open the floor to you. Do let me know whether it's written or verbal. We'll give it about 30 seconds and go from there. Yes, Doreen?
Good morning, Dr. Amanda.
Morning.
My question is, how can we best involve men, specifically the fathers to the child, and also caregivers in taking care of the woman who is pregnant, who has lupus? Because I feel that she might have more need for support during this season. Not that women don't need support, but I feel that maybe women with lupus do need more support, especially when battling with, situations of flares, and are flares even possible after giving birth is something I'd like to know, and how can somebody deal with that? Thanks.
Yeah, so involving the men in our lives and our caregivers is important. How to do so, I would say we can start by actually bringing them to our clinic visits. I've noticed even now that, it's not so common to have a man coming to the clinic, consistently. It's hard for the doctor to, once you bring them once, you can leave it to us to insist to them how important it is. But actually getting them to the clinic, I don't know, if I'm not there, I can't force them. But if they have the information about how important it is to you, how much you actually need it, they might be convinced to come. And then once they come, we will continue with that education. You can even come with your caregivers. If you're in the third trimester of pregnancy, they can come. The nanny you're planning to have can come for a couple of visits. We can give them some education about what to expect and the kind of extra support that you're going to need. And yes, after delivery, during the postpartum period, because of that rush of hormones that I spoke about, you're actually at an increased risk of getting flares. So yes, it's possible. And the people around you need to be aware and alert to catch it, because you'll be, taking care of baby and thinking about the baby. So someone needs to be taking care of and thinking about you as well. We can educate them if you bring them. Yeah.
Thank you.
All right. Thank you. Thank you, Doreen, for your very insightful question. And Dr. Amanda for your, as well, wonderful answer. So I think at this point, if anybody else is still willing to ask a question, please do. But I wanted to just say thank you to all who've joined us today, as well as Dr. Amanda for her time, and also for Lupus Foundation of Kenya partnering with us to get this thing going. We are very grateful for your presence as well.
Okay. Thank
Yes.
you so much for having me.
Mm,
Yeah.
You're very welcome. For anyone else who is curious, Dr. Amanda Kenya has she has a social media presence. If that's okay, you can follow her on Instagram. Is that okay, Dr. Amanda, if I share the at?
Yeah, sure, no problem.
Okay. So you can go look for at Dr. Kenya, OBGYN, one word. And and you can begin that journey if that's where you are, or if you are looking to your partner, or you know somebody who you're supporting, or any warrior. Feel free to let them know that Dr. Amanda Kenya is here to help them on their journey.
Oh yeah, and also if you guys have a WhatsApp group for the warriors, I would be happy to recommend some specialists that you can add to the group to help with answering some questions that you may have. So I don't know if you already have such.
Yes, we do have a community chat WhatsApp, so we can share that with you. We can send an invite link if that's okay.
Sure.
You can share with the specialists.
Yeah.
All right. Okay. So I want to thank everyone for your time and for the wonderful parties who've joined us today. And I think we can say that we are going to have a nice weekend. At least I am hopeful, because the sun is out where I am. So remember to hydrate and take care of yourselves. So thank you once again from Lupus Ascending Foundation, in partnership with the Lupus Foundation of Kenya, and also Dr. Amanda Kenya, obstetrician and OBGYN par excellence. Thank you.
Thank you.
All right. So I'll conclude the session here. This meeting will be edited for, to make it more concise, and will be on our YouTube channel. So keep an eye out for that. And thank you. Have a wonderful Saturday, and take care of yourselves and be blessed. Bye-bye.
Bye.